Thank you so much. I will call the meeting to order and ask if anyone has any pecuniary interest that they would like to disclose this morning. And we will welcome Dr. Renedade in. Is he with us this morning? There he is. Thank you for joining us, Doctor. I'm going to turn the meeting over to you.
Okay, thank you. Can you hear me? Okay, great. I have a very short update for today's meeting. And just so you know, we'll be publishing our daily case counts in between committee AM and PM. And so the numbers that I talk about today are going to be based on yesterday's report. But we reported yesterday 12 additional cases. We have a handful of outbreaks that are seeming to be well controlled with small numbers. And I would say that there has been one death in one of those outbreaks that was an institutional outbreak. And I think yesterday we were notified of a second one as well. And so I think if I remember correctly, these are people who are in a higher risk age category for mortality from COVID, but important to remember that is still happening. But not to the extent that it was happening or that it would have happened in a situation where many people were unvaccinated, as in the second or third waves of this disease. It's also, just for context, although our numbers are stable or possibly trending downwards, the Ontario numbers are trending upwards. And so I think the other day there was about 600 cases reported with, slight increases in deaths, which is a lagging indicator. So also important to keep that in mind. And then we're also in the context of seeing lots of surges in European countries. And we think in general that, that happens sort of a few months before something happens over here. So not quite out of the woods in terms of disease activity. And we've talked about what that would look like in an ongoing way. I think we need to really, shift our thinking around this to more around acknowledging that there are going to be these constant up and downs in disease activity. And then what do we do to navigate through that sustainably, right? And then just in terms of vaccines, I would say that our first and second dose coverage our second dose coverage for all the eligible population is over 81%, and that number is continually creeping upwards, but it's a slow creep, right? And so, the larger portion of our demand right now is really taken up with the third doses that are being offered to eligible populations, and we're also preparing actively for any announcements related to vaccinations for the 5 to 11-year-old population. So that's kind of what's going on here. The main things that I needed to cover with you folks, I think I talked about at your earlier council meeting. And so there was a lot of content there that really hasn't changed that much since we last met. So I think I'll leave it there.
Questions for Dr. Renedade? No questions? Looks like you got off easy this morning, Dr. Renedade.
All right, thank you.
Thank you for joining us. Have a good afternoon.
You too.
All right, we are going to go to Infrastructure and Development Services Division. There's several information reports here. I think we'll do them one at a time in case there's any questions. The first is the report regarding building services for the third quarter 2021 statistics. We need a mover and a seconder to receive and file that. Thank you, Councillor Veen and Councillor Miller. Any questions or comments? Councillor Weber, please.
I'd just like to comment on the building statistics and how things have continued and actually accelerated with the even with the pandemic, the amount of building and permits that have been issued and kudos to our staff for keeping up with that and keeping that going. I know it's been a challenge to get permits and into the office and seeing people and inspections and everything. And I commend the staff, and you look at the Lambton Shores and Sarnia results, and the building activity has been exceptionally great. So pass that along to staff if you can, Mr. Cole.
Thank you for that. I believe people are realizing the hidden gem that we have here in the county of Lambton. Any other comments on that report? All in favor of receiving and filing that? That is carried. Thank you. And we'll go to information report dated November 17th regarding the third quarter statistics approval authority activity. Is that's different, but Councillor Beans and motion or seconder. Thank you, Warden Marriott. Any comments or questions on that report? All in favor of receiving and filing that? That is carried. And the report regarding work in progress. We need a mover and a seconder to receive and file that. Thank you, Councillor Napper and Councillor Weber. Questions or comments on that report? All in favor? That is carried. We do have one report requiring a motion here. We need a mover and a seconder for that. Thank you, Councillor Hand and Councillor Napper. Any questions or comments on that? Councillor Bird.
Thank you, Chair Roundabout. I just wanted to comment about, I'm never a great one in favour of too many consultants. So if we have an ongoing continuous need for this many consultants, maybe we should hire some more staff. And so my question to staff is, what would be the financial comparison of hiring the necessary staff versus keeping the consultants all the time?
Mr. Melanson or Mr. Cole, do you want to answer that?
Thank you, Chair Rombouts. I'll let our manager of planning respond to that directly. That's great.
Thank you. Through you, Madam Chair, to Councillor Bird, I'd remind committee that we've actually been in the process of adding staffing resources. So we had a staffing resource increase of 2 earlier on this year. Then there was a subsequent addition of 2 more. So this is all about right-sizing our resources and our toolkit to be able to respond to the increasing level of activity that is happening across the county municipalities that the county provides planning services to. So what's been happening is as those application volumes have been growing, the operational side has been the focus. So applications, and so we have a backlog of applications that we're working through in a number of municipalities, but then all of the policy work has been sort of set aside. And this was the use of consultants that we did for the 3 OP updates mentioned in the report was the first time we've ever used consultants for planning and development services. So, you know, judging from the comments that we received from the 3-member municipalities and how well it worked out and how quickly the work was able to be done, and as under budget as it came, we see this as an important piece of our toolkit to right size the department for the level of growth that we're seeing.
So thank you. And just one further comment. So in your mind, how long do you see it being to clear up the backlog and not have a need for consultants? Is there a time when you can see that balance being achieved? Through the chair, I can say that we've probably got at least a good 5 years of steady work in policy to update all of the official plans across the county. Keep in mind, we had a year, I think it was this year or perhaps last year, where the province amended the municipal government, thinking a different province, the Planning Act, several times. And so every time those amendments kick in, it puts us that much further behind. And we already know that there's at least one more amendment coming with Bill 13, which will likely occur probably sometime mid next year. So we're always at some level of playing catch up with the province. Okay, thank you very much.
Councillor Napper.
Yeah, we were very pleased. It really moved along in a timely manner in the way that there was more one-on-one consultation than what we would get probably if we'd done it ourselves. That we'd come to a public meeting and all the people had questions that they were pretty well answered through through the consultants, and they done an excellent job. I was really pleased with them, and I think it was well worth the effort, and kudos to everybody involved in that.
At the risk of leading from the chair, I would 100% agree with Councillor Napper, and because we were part of that process, and using the consultants for the official plan amendments was different than just day-to-day operations. It was on top of everything else, so it was very helpful. Any other questions or comments? Thank you, Councillor Hand.
Yeah, I was going to say the same thing as one of the communities that was involved in consultant work. It went smoothly, and it wasn't the same as adding new staff because it was a specific short-term project. So we were able to get the work done through the pandemic in unusual circumstances. And yet that was a good chunk of work that was completed. So we appreciated it.
I'll be happy to pass those comments on to the consultant team. Thank you.
Councillor Napper.
Yeah, I'd like to move this motion to continue the system we're using now.
I believe we have a mover and a seconder.
I'm sorry.
Nope, that's okay. Thank you, though. If there's no other questions or comments, then we'll call the question. All in favor? That is carried. Is there any other business today, Mr. Cole?
Oh, thank you, Chair Roundbouts. I think that's everything today.
Thank you. Have a good day. And we'll move on to the Public Health Services Division. There are several correspondence to receive and file. How does the committee want to deal with those correspondence? Councillor Weber?
I move those.
Thank you. And to seconder, Councillor Miller? Any questions or comments on any of those? All in favor of receiving and filing those correspondence? That is carried. Thank you. And we have 3 information reports here. Do we want to move those together or separately? Councillor Bean.
I'll move them all together.
Perfect. Thank you. Do we have a seconder to that motion? Thank you, Councillor Hand. Questions or comments on any of these information reports? Councillor Weber.
Again, I want to thank staff for the beach quality reports. Very important work for us to continue having those quicker results that are put in place. So it's been a good program, and I hope we continue with that.
Thank you. I just had a question about information report C on the vaccine planning for children. There was quite a discrepancy between the estimated number of percentage of parents that were wanting to vaccinate their children compared to what the survey came back with. Is that going to affect how we prepare for this rollout?
Hi, it's Kevin Churchill here. I'm here in place of Andrew Taylor today. I'm sorry, I'm not quite understanding your question, Chair Rumboats.
It says in the results, it's estimated that 61% of parents in Lambton County with children 5 to 11 are likely to vaccinate their children against COVID-19 when they become eligible. This is considerably higher than the estimate from the Lambton Public Health Parent Survey, which found that 27% and 36% plan to vaccinate their children ages 5 to 7 and 8 to 11, respectively.
Okay, thank you. That's a great question. Our epidemiologist, Siobhan Churchill, is on the line, and she's the author of that report, and she can answer that question.
Thank you.
Hi, yes, I'm happy to speak to that. So both of these are surveys of residents of Lambton County, and the 61% comes from our Ipsos telephone survey, which randomly samples members of the community and asks whether they would plan to vaccinate their children. And that's the evidence that is of higher quality, because people cannot choose to participate in that survey and possibly participate multiple times. They're randomly selected using phone numbers. So that's the point of reference that we're using for our clinic planning, that 61% of parents with kids age 5 to 11 plan to vaccinate their child when they become eligible. And in our online survey where anyone could participate, we did find some evidence of people participating potentially multiple times and saying that they were unlikely to vaccinate their child. So we're really glad that we have that information from our telephone survey to back that up.
Okay, thank you for that. Any other questions? All in favor of receiving and filing those information reports? That is carried. Thank you. And we have two reports requiring a motion. The first is regarding infection prevention and control hub funding. Do we have a mover and a seconder for that recommendation? Moved by Councillor Veens. Seconded by Councillor Weber. Questions or comments on that report? All in favor of the recommendation? That is carried. And then we have the report regarding Lambton Public Health staffing requirements. Do we have a mover and a seconder for that recommendation? Thank you, Warden Marriott. And seconding that, Councillor Miller. Questions or comments on that report? All in favor of the recommendation? That is carried. Is there any other business today, Mr. Churchill?
Oh, I think that's everything. Thank you very much for your support.
Thank you for your time. Have a good day.
Thank you.
And we'll move on to Cultural Services Division. There are two correspondence to receive and file. Do we have a mover and a seconder to receive and file those correspondence together? Thank you, Councillor Veen. And seconded by Councillor Weber. Any questions or comments on either of those? All in favor of receiving and filing those? That is carried. We have two information reports. We want to deal with them together or separately today. Councillor Hand, would you like to deal with them together? Thank you.
Yes,
and
please.
Seconder. Thank you. Seconder to that? Councillor Veen. Any questions or comments on either of those reports? All in favor of receiving and filing those? That is carried. And we have one report requiring a motion concerning the generous donations given to us. Councillor Weber and Councillor Veens, you're supporting that recommendation? And any questions or comments on that? All in favor of receiving and filing that? Thank you. Mr. Meyer, is there any other business to deal with today?
Nothing for me today, Chair. Thank you.
All right. Thank you so much for your time. Have a great day. And we just have one information report in Corporate Services Division regarding the 2022 committee membership rotations. We just need a motion to receive and file that. Moved by Councillor Veen, seconded by Councillor Hand. Any questions or comments on that report? Councillor Weber.
I did notice that my name's not on the list, and Warden Marriott is on the list, so I think those need to be switched out. It's probably an older list, so as long as that correction is made, thank you.
I'm getting the thumbs up from Mr. Tifo, so I'm assuming that that is noted and will be corrected.
That's correct.
Thank you for bringing that to the committee's attention. Councillor Napper, do you have a question?
I'd just like to let's make a deal. If anybody on the morning committee wants to switch to the afternoon, I'd be up to doing that, but it don't matter. I'm happy to stay where I am, but if somebody wanted to switch that, I'd be glad to do it, to accommodate them, not me.
Well, Mr. Napper, I am on your group, so I'd be happy to switch with you if you'd like.
I love the morning committee. I think
I have no problem switching. I am happy to serve on the committee PM if you'd prefer to sit on committee AM.
Yeah, I'm a better morning person than in the afternoon because sometimes it gets in my nap time.
Mr. Tifo, if you want to make that correction, is that okay for us to do that swap?
Yep, it is, as long as you're within the same group. Yes, absolutely. And we anticipated a few swaps.
Okay.
Thank you very
Councillor Weber.
I have not talked to Councillor Cook, but I know he had at one time preferred the PM committee. It worked better for him with his business. So I will chat with him, and if we stay on the same committee, we're both in the same group, so that may work. So.
Well, our quadrant is very accommodating. That's great. Any other swaps or changes to that? Seeing none, all in favor of receiving and filing that report? That is carried. And if there's no other business from the Corporate Services Division, thank you, Mr. Tifo, for your help tonight. And we have no in-camera, so we just need a motion to adjourn. Thank you, Councillor Bean. Seconded by Councillor Miller. All in favor? That is carried. Thank you so much, everyone. Have a wonderful day.
Have a great day.